7:10 on News Radio 1110 KFAB. Art Jetter, the official Evil Insurance Man of the Morning News, joins us in 6.5 minutes about the impact of the Berkshire Hathaway, J.P. Morgan Chase, Amazon announcement yesterday. They're getting into the health insurance business. What does that mean for the big traditional health insurance companies, and why did the market go nuts about them yesterday? Art Jetter coming up. Good morning, Gary Saddlemeyer, KFAB's Morning News. So the market went nuts yesterday, partly because the big health insurance stocks took a tumble on the news about Berkshire Hathaway and Amazon and J.P. Morgan Chase deciding to get together and get into the health insurance business. So we welcome to the program the official Evil Insurance Man of KFAB's Morning News. From Art Jetter and Company, here's Art. Art, good morning.
Good morning, Gary.
It's great to have you here. Is there any, do you think this is a legitimate concern? That Aetna and all of the other big guys are going to be hurt badly by this move?
Well, I don't necessarily think that's what's going to happen. I think that the stock prices. Now, I'm not a stockbroker, so I don't give stock advice. Right. But I think that it's the prices fluctuated yesterday because of the uncertainty after the announcement what this would mean to them. I don't think that they have an idea exactly what might transpire. I think this is really probably good news for consumers, even exciting, because it might help control the cost of care. Of course, we need to follow this to be certain. Initially they're going to focus on technologies to bring transparency and consumer satisfaction to their own employees between these three organizations.
Yeah, when they talk about, what do they mean when they talk about transparency? In other words, the transparency of the costs that providers charge?
Yeah. Okay. Of course. I mean, look, if you go get your tonsils out, what's the cost going to be? Or when do you find out? You find out when you get the bill.
Well, a mutual acquaintance of ours who's a very big deal in the insurance business, we chatted a little bit yesterday, and he said there's a misconception that the big companies are just rolling in profits, that the margin is actually pretty small, so that the idea that these three companies can just because they're not going to take a profit, that they can drastically reduce the costs, that concern is overblown. Do you agree?
I agree. The Blue Cross Blue Shield of Nebraska is a not-for-profit organization, and mutual insurance companies are owned by their policyholders. So I don't think that in itself is the cost saver. I think the technologies of which they focused, the press release, could be very helpful. I mean, I can give you some examples where I think might save some money, and I think it could spread throughout the healthcare system. They might find ways for healthcare providers to reduce their internal cost of administration, which ends up going right to the bottom line and helps reduce costs to employers and consumers. And maybe they can make electronic medical record keeping affordable, personal, portable, and assure privacy and security. Maybe they can get rid of or control fraud, which is a huge issue in the healthcare economy.
Yes, it is. Well, that's all to the hopefully you're right that because if you look at all of the companies that Warren owns, and then you look at J.P. Morgan Chase, and you look at Amazon, you're talking about a lot of people, so they could have an impact.
But they have their people, their employees alone, they have, I think they said 1.1 million between the three companies, and it could be that they just take care of their employees, and they set a wonderful example for others. Could be that they introduce technologies into the marketplace, or it could be something that insurance companies ought to be concerned about. But, when you talk about these companies are self-insured. They're paying for their own administration. Mm-hmm. So it's not like an insurance company is in the middle of this reaping wonderfully huge profits. And if you buy an insurance policy, the odds are that your premiums are going to amount to pennies as far as the company is concerned, as far as profit. But so I don't think that the profit margins are really at all an issue. Yeah. I think it's this ability to control prices of healthcare costs, bring technologies that make things work. When I change physicians, I don't have to go pick up a packet of materials and carry it over to the next one. And, things could be really electronically portable. And personal. So I think there are a lot of things that could happen here.
Interesting. Let's hope it's a positive for the industry, too. Arthur, thank you. It's always good to have you on.
Yes, sir.
The official evil insurance man of KFAB's Morning News. That's Art Jetter. Right now, we go to Sports Brief. Here's Jim Ross.
All right, Saturday. Good morning, everybody.